Are my symptoms caused by multiple sclerosis? This is a very, very common question. I remember one week in the clinic, we had 20 patients that came in the office 1 week that thought they had MS. Amazing. Are your symptoms caused by MS? So what are the most classic symptoms? Most classic is optic neuritis, and this often occurs very young. You get sort of a cloud pulls down over your eye and you get blurred vision in one eye and you have optic neuritis. Stroke-like symptoms. So if you've had optic neuritis and you have a stroke-like symptom, numb on your face, numb on your side, those are symptoms that could very well be from multiple sclerosis. So many other symptoms are so vague with multiple sclerosis. I saw a patient one day, and I think I've probably seen 50 since, that just were dizzy, ended up having multiple sclerosis. But when I delved back into the history, most of those patients said, 20 years ago I had an episode my face went numb. 20 years ago I had an episode where my right eye went blind, and it came back after a month or so. Doctors never knew what it was. So when you do a good history, you'll find, a second event. So the McDonald criteria are pretty specific, but just in general, the way I like to think about it, if you've had 2 MS attacks 2 different times in your life, 2 different parts of the brain or spinal cord, then you have definite multiple sclerosis. It's a little more complicated than that because we're more aggressively treating people that, have only had one event. We even have the patients come in with what we call radiographically isolated syndrome, where they come in, maybe have a car wreck and they get an MRI, and the MRI is classic for multiple sclerosis. But they've had no attacks ever. We do yearly MRIs on those patients. And up to 80% in 15 years will develop multiple sclerosis. It's a very large number. So when you have that MRI, are my symptoms caused from MS? It'll show up on an MRI. I've heard of patients that have normal MRI of the brain, normal MRI of the cervical spine, normal MRI of the thoracic spine that have multiple sclerosis, but that's something I find really hard to believe. And so I just don't see that very often. MRI is so sensitive. So are your symptoms caused by multiple sclerosis? You better get MRIs. That's the starting point. And then move forward with the workup they recommended: lumbar puncture, evoked potentials, and lab work and testing, review all the mimics that can cause multiple sclerosis, like Lyme's disease, meningitis, HIV disease, syphilis, TB, other viral infections, meningiomas, gliomas, lymphomas, metastatic disease, all the mimics that sound like multiple sclerosis. So are my symptoms caused by multiple sclerosis? Start with that MRI of the brain. That's the first start. And just push your doctor to get that, because you're not going to feel better till you do. And we're going to do, multiple MRIs on multiple sclerosis. There's so many new treatments of multiple sclerosis. The last I counted 14, but I didn't count it up before this video. A lot of disease modulating therapies for multiple sclerosis. So it's just an exciting time in the treatment of MS. So more later.